Hey everyone, welcome back for another deep dive. Today we're tackling a topic that can be a real challenge in the field: abdominal and genitourinary trauma. Those injuries that aren't always obvious, but can quickly turn critical. We've got some great EMT training materials lined up to guide us. So get ready to sharpen your assessment skills and learn some life-saving interventions.
Absolutely. We're going to break down the anatomy, explore common mechanisms of injury, and most importantly, arm you with the knowledge to confidently assess and manage these tricky cases.
All right, let's dive right in. First things first, anatomy. When we're talking about the abdomen, think quadrants. It's like a mental map. That helps us zero in on potential injuries. Imagine two lines intersecting right at the belly button, dividing the abdomen into four sections.
Okay, so we've got the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Always remembering to view it from the patient's perspective.
Exactly. It's like putting ourselves in their shoes. Literally. Now, why is this quadrant knowledge so crucial? Well, let's say you're assessing a patient with pain and swelling in the right lower quadrant. That could be a red flag for appendicitis, which, if it ruptures, can be a serious situation.
Absolutely. Knowing which quadrant is affected helps us narrow down which organs might be involved.
No.
It's like a detective game, piecing together clues to figure out what's going on inside.
Okay, so we've got our quadrants sorted.
Hmm.
Now let's talk about the organs themselves. The source material breaks them down into two main types: hollow and solid. Can you give us the lowdown on those?
Sure, hollow organs like the stomach, intestines, and bladder are essentially tubes that transport substances throughout the body. Think of them like pipelines.
Pipelines that we definitely don't want bursting.
Yeah.
Because if a hollow organ ruptures, all those contents spill into the abdominal cavity, causing intense inflammation and infection, a condition called peritonitis. Our sources describe it as a real medical emergency.
Right. And then we have solid organs like the liver, spleen, and kidneys. These are dense, hardworking organs packed with blood vessels. So when they're injured, internal bleeding becomes a major concern, even if we don't see obvious external signs.
Like a hidden danger lurking beneath the surface. And speaking of hidden, our source material mentions this tricky area called the retroperitoneal space
Mm?
in the back of the abdomen. What's the deal with that?
Think of it like a secret compartment behind the main abdominal cavity. That's where the kidneys, bladder, and part of the pancreas reside.
Hmm.
And because they're tucked away back there, injuries to these organs can be especially difficult to detect.
So knowing the anatomy is like having a roadmap to guide our assessment. But of course, injuries don't just appear out of thin air. We need to consider the mechanism of injury. That's the force or event that caused the trauma. Our sources highlight two main categories: blunt trauma and penetrating trauma.
Right. Blunt trauma is like an invisible force. Think car crashes, falls, or even a hard blow to the abdomen. Even if there's no break in the skin, the internal damage can be significant.
And speaking of car crashes, one of our sources actually includes a really helpful visual of proper seatbelt positioning. It turns out that wearing a seatbelt too high can actually increase the risk of abdominal injuries during a collision. Who knew?
Yeah, it's a good reminder that even safety devices can have unintended consequences if they're not used correctly. Now, with penetrating trauma, we're talking about objects that break through the skin and enter the body, like knives, bullets, or even impaled objects.
Okay, now for the image that's probably going to stick with me all day, evisceration.
Yeah.
Our sources describe it as the protrusion of organs through a wound. It sounds pretty intense.
It's definitely a sight that can make even the most experienced EMT pause. But remember, it's crucial to stay calm, assess the situation, and follow protocol. Never try to push those organs back in. Instead, focus on controlling bleeding, applying a moist, sterile dressing, and transporting the patient promptly.
Right, because in these critical situations, every second counts. All right, so we've covered the abdomen, but let's not forget about the other half of our deep dive, the genitourinary system.
Right. This system is responsible for both waste removal and reproduction. And just like with the abdomen, understanding the anatomy is key to recognizing and managing injuries.
Absolutely. Our sources point out some key differences in male and female anatomy. Male genitalia are mostly external, while female genitalia are largely internal and well protected within the pelvis.
Of course, pregnancy changes the game entirely, making the female abdomen more vulnerable to injury. It's another layer of complexity that EMTs need to be aware of.
And before we move on to specific injury types, I think it's important to acknowledge the sensitive nature of this area. EMTs need to be especially mindful of protecting patient dignity and maintaining professionalism when assessing and treating genitourinary injuries.
Absolutely. These situations can be incredibly embarrassing and traumatic for patients. So our approach should always be respectful, compassionate, and focused on providing the best possible care.
Okay, so we've laid the groundwork with anatomy and mechanisms of injury. Now let's get into the nitty-gritty of assessment. Where do we start when we encounter a potential abdominal or genitourinary trauma in the field?
It all begins with the scene size up. Safety first, always. Then we quickly assess the mechanism of injury, determine if spinal precautions are needed, and decide whether we need to call for additional resources.
And don't forget, building rapport with the patient is crucial, especially in these sensitive situations. They might be hesitant to disclose information due to embarrassment, so a calm, reassuring demeanor can go a long way in gaining their trust.
Yeah, once the scene is safe and we've established a connection with the patient, we move on to the primary assessment. This is our rapid evaluation to identify and address immediate life threats.
Right, it's all about prioritizing those ABCs.
Exactly. We start with CAB, control any major bleeding, airway, breathing. Then C for circulation, checking pulse, skin condition, and capillary refill. And D for disability, assessing the patient's level of consciousness.
It's amazing how those simple letters can guide us through such a critical process. Now, I know we often associate dramatic bleeding with trauma, but it's important to remember that genitourinary injuries, even if they're not visually obvious, can also lead to significant blood loss and shock.
You're absolutely right. So we need to be vigilant, even if the external signs aren't screaming emergency.
Okay, once we've addressed those immediate life threats, we move on to history taking. This is where we gather crucial information from the patient to help us paint a clearer picture of what happened and how severe the injuries might be.
And to make sure we cover all the bases, we have some handy mnemonics to guide us. SAM allele for the overall history, and OPQRST for pain assessment.
Love a good mnemonic. It's like a sheet code for EMTs.
Right. SAM allele helps us remember to ask about signs and symptoms, allergies, medications, past medical history, last oral intake, and the events leading to the injury. It ensures we get a comprehensive overview of the patient's background and current situation.
And then OPQRST digs deeper into the pain itself: onset, provocation or palliation, quality, region or radiation severity and timing. It's like zooming in on the pain with a magnifying glass to understand its nuances.
And don't forget to ask specific questions related to abdominal and genitourinary trauma. Things like, have you experienced nausea, vomiting, or diarrhea? What did your bowel movements or urine look like? Did you notice any blood? And is there any pain radiating to other areas?
Those are all great points. Now, once we've gathered the history, we move on to the secondary assessment. This is where we get more hands-on, right?
Exactly. The secondary assessment is a more detailed exam, but our sources acknowledge that we might not always have the time or resources for a full head-to-toe assessment, especially if the patient needs immediate life-saving interventions.
So how do we prioritize in those time-sensitive situations?
Well, if we're dealing with an isolated injury, we can focus our exam on the affected region, but if there's a suspicion of multi-system trauma, a full head-to-toe exam is crucial.
And, of course, we have another trusty mnemonic to guide us through the secondary assessment: DCPP-BTLS. I always picture it like a mental checklist to make sure we don't miss any important details.
Deformities, contusions, abrasions, punctures or penetrations, burns, tenderness, lacerations, and swelling. It covers a wide range of potential findings and helps us systematically assess the patient from head to toe.
When we're palpating the abdomen, always remember to start away from the area of pain and palpate gently. This helps us check for radiation of pain and guarding, which can be a sign of peritoneal irritation.
That's a great point. Now, the last piece of the assessment puzzle is reassessment.
It's like the ongoing monitoring phase, where we keep a close eye on the patient's vital signs, evaluate the effectiveness of our interventions, and document any changes in their condition.
Exactly. Reassessment helps us ensure we're providing appropriate care and allows us to adjust our approach as needed. And of course, clear communication with the receiving hospital is paramount.
We need to paint a clear picture for them, using approved medical terminology and highlighting any pertinent negatives, so they can be prepared to receive the patient and continue care seamlessly.
Speaking of care, let's shift gears now and talk about the specific interventions we can use in the field for these types of injuries. That's where we'll pick up after a quick break. All right, we've covered a lot of ground with anatomy, mechanisms of injury, and the assessment process.
Now let's roll up our sleeves and talk about what we can actually do for these patients in the field. What are some key interventions for abdominal and genitourinary trauma?
Well, first and foremost, It's important to remember those foundational principles of emergency care. We're talking about patient comfort,
Mhm.
especially with these sensitive injuries. Privacy, reassurance, treating them with dignity and respect, those go a long way.
Our sources really hammer that home. And it makes sense, pain and embarrassment on top of a physical injury.
Mm,
That's a lot to deal with.
absolutely. And of course, we never lose sight of our basic life support, or BLS protocols. Airway management, oxygen administration, and aggressive treatment for shock always take priority.
Those are our bread and butter.
Yeah.
Fundamentals we always fall back on. Okay, so with that in mind, let's get specific. What do we do for closed abdominal injuries where there's no visible break in the skin?
In those cases, our focus is on supportive care. We're monitoring closely for signs of shock, managing any nausea or vomiting, administering oxygen as needed, and keeping the patient warm.
Basically making sure they're as stable as possible while we get them to definitive care.
Exactly. But with open abdominal injuries, things get a bit more, well, you saw that image of evisceration.
Yeah, I don't think I'll be forgetting that anytime soon. Definitely got my attention. So open wounds, exposed organs, what's the game plan?
First, control any bleeding. Then we need to dress those wounds appropriately, stabilize any impaled objects, and for evisceration, never, ever try to push those organs back in. Our sources are very clear on that.
Makes sense. So
Yep.
what do we do?
A moist, sterile dressing applied to the eviscerated organs, cover with a bandage, and transport promptly. Keeping those exposed organs moist helps prevent further damage and infection.
Okay, counterintuitive but crucial. Got it. Now, what about specific interventions for those internal organ injuries we discussed earlier?
Let's start with kidney injuries. The treatment is very similar to our approach for closed abdominal injuries. Treat for shock, monitor vital signs closely, and transport promptly. Early recognition is key here.
And for urinary bladder injuries, same story.
Pretty much, we manage shock, address any associated injuries,
Yeah.
and get them to a facility equipped to handle those complex cases.
Okay, so those are somewhat similar approaches. Now, external male genitalia injuries, our sources had some specific guidelines for those.
Right. Control bleeding. Dress the wound appropriately, and if there's avulsed skin, try to preserve it. And if there's an amputation, we need to wrap the amputated part in a moist, sterile dressing, put it in a plastic bag, and transport it with the patient, keeping it cool, but not in direct contact with ice.
It's amazing that in some cases, surgical reconstruction is possible. Really drives home the importance of following those protocols to give the patient the best chance.
Absolutely. Now, for female genitalia injuries, the focus is on applying moist dressings, controlling bleeding, and stabilizing any foreign objects. And one crucial point, never pack the vagina.
Noted. All right, before we wrap up, we need to address a special case. Sexual assault.
This is where our compassion and professionalism are truly put to the test. Our sources emphasize supportive care and transport to a facility equipped to handle these cases.
Right, we're not investigators, but we are advocates for our patients. So we limit genital examination unless there's bleeding that requires it. We treat other injuries, provide privacy and emotional support, and follow proper crime scene protocols to preserve evidence.
It's also important to document everything thoroughly and advise the patient against washing, eating, drinking, or anything that could compromise evidence collection before a medical exam.
So much of our role goes beyond the immediate medical care. We're part of a bigger process. And in these sensitive situations, that's even more apparent.
Well said. We've covered a ton of information about emergency care for abdominal and genitourinary trauma. Hopefully you're feeling more confident and prepared to face these situations in the field. But before we sign off, I want to leave you with this. Think back to all those assessment tools we discussed. The mnemonics, the systematic approach, those are fantastic resources. But sometimes a patient's presentation won't fit neatly into those boxes.
You're right. Not every case is textbook. So what do we do when those curveballs come our way?
Well, that's where your critical thinking skills really shine. It's about connecting the dots, looking for patterns, and trusting your gut instinct when something doesn't feel quite right.
And never being afraid to ask for help or a second opinion if you need it, right?
Exactly. Collaboration is key in our line of work. Two heads are often better than one, especially when we're dealing with these complex cases.
Okay, so we've got our knowledge base, our assessment tools, and our critical thinking caps on. What else should we be thinking about as EMTs heading out into the field?
I'd say the most important thing is to never stop learning. The field of emergency medicine is constantly evolving, so staying up to date on the latest research, guidelines, and best practices is essential.
It's like we're lifelong students, always adding to our knowledge toolkit.
Precisely, and don't underestimate the power of simulation training. Practicing those assessment skills in a safe, controlled environment can really boost your confidence, prepare you for the real deal.
It's like a dress rehearsal for those high-pressure situations.
Yeah.
All right, so we've covered a ton of ground today, from anatomy and mechanisms of injury to assessment techniques and emergency care. What are some key takeaways you want our listeners to walk away with?
First and foremost, remember that abdominal and genitourinary trauma can be deceptive. Those injuries aren't always obvious, so maintain a high index of suspicion, especially in cases of blunt force trauma.
Right, don't let those subtle signs fool you. Early recognition and intervention can make a world of difference.
Absolutely. Second, mastering those assessment skills is crucial. Those mnemonics we talked about, SAML, OPQRST, DKIP, BTLS, those are your allies in the field. Use them to guide your assessment and ensure you're not missing any vital information.
They're like mental checklists to keep us on track,
Mm.
especially when the pressure's on.
And finally, never underestimate the importance of clear communication, whether it's with your partner, dispatch, or the receiving hospital. Concise, accurate information is essential for seamless patient care.
It's all about teamwork, making sure everyone is on the same page to provide the best possible outcome for the patient.
Couldn't have said it better myself.
Well, I think we've officially unpacked abdominal and genitourinary trauma. I feel like I learned so much today.
Me too. It's always a pleasure diving into these topics and sharing the knowledge.
A huge thanks to you for guiding us through this deep dive. And all of you listening out there, thank you for joining us. Stay safe, stay sharp, and keep those brains engaged.
And until next time, remember, knowledge is power in the field of EMS.
That's a wrap, everyone.